Teenage drug addiction, reasons, effects, and prevention. The aim of this campaign is to give awareness about the rising number of teenage drug addiction in the Philippines and inform the audience about the effects of drug addiction on the physical, psychological, and mental health of a person, and at the same time, to persuade the audience about the strategies to prevent teenage drug abuse. The main motive of this campaign is to educate people about the dangers of drugs and help those teenagers who are already engaged in drug abuse. Based on the Dangerous Drugs Board, 1 in 2 drug users in the Philippines begin experimenting with illegal drugs when they are between the ages of 15 to 19 years old. And as per National Institute on Drug Abuse, 1 in 3 students in 12th grade use marijuana, making it the most widely abused illicit drug. While there are no accurate statistics available, it is estimated by the Dangerous Drugs Board that 65% of 3.7 million users in the Philippines are young people. The 5 common reasons why majority of the drug users are teenagers. First is curiosity and experimentation. Second is peer pressure. Third is stress and anxiety. Fourth is enjoyment. And lastly, personal problems. How do drugs affect our physical, psychological, and mental health? On physical health, abusing drugs can cause irreversible damage to blood vessels in the brain that would lead to stroke. The second is the increased strain on the liver, which puts the person at risk of significant liver damage or liver failure. Abusing drugs can also weaken our immune system, which means our body has a high risk of infection and illness. It would also reduce our ability to perform tasks that require concentration and coordination. Psychological health. The person who's abusing drugs may experience a loss of interest in friends, family, sports, and other activities. They could also suffer from hallucinations and what we call coke bugs. It is a sensation wherein a person is imagining that the insect is crawling over their skin. They could also experience a sense of distance and estrangement. Mental health. Drug abuse can increase the irritability, panic attacks, and confusion of a person that would result in difficulty in making decisions. They could also be erratic, violent, and paranoid to anyone. Abusing drugs can trigger the depression, anxiety, and paranoia of a person. Strategies to prevent teenage drug addiction. The first one is by establishing open communication with the teen. The parents should inform them that abusing drugs can ruin their relationships with other people, their health condition, and potentially their future. Second is to set clear rules and consequences. In this way, the teen would feel safe and loved. Next is to get involved in their life. The parents should spend some time with their kids so the teen would not feel that their parents are not giving them full attention and proper care. And lastly, by making your home feel safe. It is very important to know the people you live with and avoid those people who are taking drugs that might influence your teen. This problem is very timely in our country. We should start to educate young people about the dangers of drugs and how they would affect their choices in life. To those teenagers who started to engage in drug abuse, let us help them by letting them know that it is never too late to stop drug addiction. To parents, know your teen's activities and friends. To our head leaders, we must start to implement a program that will help the teenagers to grow, feel active, and safe without worrying about the people they spend with. And to everyone, we should start to focus more on prevention rather than being punished on this society.